Oh, oh, why am I waking up so early? Mm. Goodness, goodness, goodness. Boy, oh boy, I feel great. There's an familiar feeling. Can't quite make it out. Is that what I think it is? Well, hey there, little guy. Haven't seen you in a while. Let's wake up Nadine. Nadine, wake up, honey. You won't believe it. The little guy just sprouted out on his own. He wants to come out and say hi to you. Why don't you wake up and take a look?
Leave me alone, Henry. I have a mild headache over my right temple. I'm fatigued and slightly weak.
Fine, be that way. Guess I'll just go take a shower. Ah, that's better. Hey, babe, I'm back from my shower. Are you feeling any better? Oh, Henry, no, I don't know again. What? What'd you say, woman? Sit up, I can't understand you. Oh, Henry, something's wrong. It's completely true. My face was funny. Holy Jehoshaphat, Nadine, what's wrong with your left side of your face? It's all droopy. Heavens to Murgatroyd, I gotta get you to the hospital right away. Okay, sweetie pie, we need to get going. Can you get out of bed? Are you okay? Oh, Harry, no. I feel so weak. I can't move. Oh, baby. Here, take my hand. Can you take my hand and get up? No, Henry. The left side of my body is too weak. Okay, baby. I'll pick you up if I have to. We're getting out of here now.
Nadine Turner arrives at the emergency department. Her past medical history includes paroxysmal atrial fibrillation, hypertension, hyperlipidemia, and a remote history of deep vein thrombosis. A recent cardiac stress test was normal, and her blood pressure has been well controlled. Nadine Turner is currently taking flecainide, Tambacor, hormone replacement therapy, amlodipine, Norvasc, aspirin, simvastatin, Zocor, and lisinopril, Zestril. After a non-contrast CT scan, she is diagnosed with a thrombolytic stroke. The physician writes the following orders.
Hi, my name is Christina, and I'm a nurse at Galen Hospital.
Hello, my name is Jennifer, and I am a registered nurse here at Galen Hospital.
Hello, my name is Amber Nelson, and I'm a registered nurse here at Galen Hospital.
Well, hello. My name is Shalonda Stinson, and I'm the head nurse here at Galen Hospital, and it's my duty to make sure you feel all better.
Physician's orders for NT read: IV fluids of normal saline at 75 milliliters per hour, active ACE or TPA per protocol, stat CBC, PT-INR, and CK isoenzymes, neurologic assessment every hour, obtain the patient's weight, vital signs every hour, and oxygen at 2 liters per nasal cannula. Question 1. Outline a plan of care for implementing these orders. The best plan of care for implementing these orders for NT would be to first put her on oxygen at 2 liters per nasal cannula. Then you would get your stat CBC, PT-INR, and CK isoenzymes. Third, obtain the patient's weight. Fourth, do your TPA per protocol. Fifth, IV fluids normal saline at 75 milliliters per hour. 6, vital signs every hour. And then last, you would do your neuro assessment every hour after that. The instructions on the TPA vial read to reconstitute with 50 milliliters of sterile water to make a total of 50 milligrams to 50 milliliters. The hospital protocol is to infuse 0.9 milligrams per kilograms over 60 minutes with 10% of the dose given as a bolus over 1 minute. NT weighs 143 pounds. What is the amount of the bolus dose, in both milligrams and milliliters, that you will administer in the first minute? What is the amount of the remaining dose that you will need to administer? The amount of the bolus dose that you will administer in the first minute is 5.85 milligrams or 5.85 milliliters. The amount of the remaining dose that you will need to administer is 52.65 milligrams per hour or 52.65 milliliters per hour. Question number 3. What are the 3 types of cerebrovascular accidents, or CVAs? The 3 types of CVAs are hemorrhagic, embolic, and thrombotic. Question number 4. What role do diagnostic tests play in evaluating NT for a suspected CVA? Diagnostic tests will confirm diagnosis of a CVA. A negative CT will indicate thrombotic or embolic stroke, and a positive CT is indicative of a hemorrhagic stroke.
Number 5. Explain how the type of stroke is an important factor in planning NT's care. The interventions for patients experiencing a stroke are specific to the type of stroke. Ischemic strokes start 2 IVs with non-dextrose isotonic saline, administer TPA, anticoagulants, or antiplatelets. Hemorrhagic strokes, surgery, clipping, coiling, drain, meds to prevent seizures and control vasospasms, monitor for increased intracranial pressure. Number 6. Contraindications for beginning fibrinolytic therapy include, select all that apply. A. Currently on Coumadin with an INR of 2.4. B. Major surgery in the last 14 days. C. Systolic BP of 150. D. Platelet count of less than 100,000. E. Blood glucose of less than 50 milligrams per deciliter. F. History of myocardial infarction 1 year ago. G. Improving neurologic status. And the correct answers are A. Currently on Coumadin with an INR of 2.4. B. Major surgery in the last 14 days. F. History of myocardial infarction 1 year ago. G. Improving neurologic status. Number 7. What is the purpose of monitoring the CPK isoenzyme levels? The purpose of monitoring CPK is because it shows damage to cardiac, musculoskeletal, and neural systems, allowing amount of damage to be assessed. Number 8. If NT's deficits are temporary, how long might it take before they are completely reversed? Since NT's deficits are temporary, the effects should be reversed by the end of NT's hospital stay.
Nadine Turner is admitted to the neurology unit. A second CT scan, 18 hours later, reveals a small CVA in the right hemisphere. She is placed on flecainide, Tambacor, amlodipine, Norvasc, clopidogrel, Plavix, aspirin, simvastatin, Zocor, and lisinopril, Zestrel.
Number 9. While assessing NT, you note that the following findings. Which one is unrelated to the CVA? A. Headache. B. Lethargy. C. Lumbar pain. Or D. Blurred vision. The answer is C. Lumbar pain is unrelated to the CVA. Number 10. Your coworker states, I always heard that atrial fibrillation is a precursor to stroke. Explain whether this statement is true or false. AFib is not a precursor to a stroke. It is a risk factor. Due to the irregular heartbeat, blood may sit in a chamber longer than normal, therefore cause clots. Number 11. Why was NT placed on Plavix post-CVA? NT would take Plavix to prevent further clotting issues. Number 12, because NT had a thrombolytic infusion, how many hours should you wait before beginning administration of any anticoagulant or antiplatelet medication? We would wait for 24 hours.
Nadine Turner is not on hormone replacement therapy post-CVA. Why would this medication be discontinued? Hormone therapy would be discontinued because estrogen is known to increase the risk of stroke. Is there any benefit from continuing simvastatin Zocor after her CVA? Yes. Simvastatin Zocor reduces risk of stroke and it helps treat her hyperlipidemia. As you walk into the nurse's station, the charge nurse is talking to Nadine Turner's physician, who ordered a modified barium swallow study and referral for a speech-language pathologist, occupational therapist, and registered dietitian. Give the rationale for these orders. The speech-language pathologist will conduct a swallow study to assess for dysphagia. The occupational therapist assesses for fine motor skill deficits and treats accordingly. The registered dietitian will modify diet based on swallow study findings. Nadine Turner's blood pressure should be well controlled. What blood pressure level should be considered normal for her based on the 7th report of the Joint National Committee on Prevention, Detection, Evaluation, and Treatment of High Blood Pressure? According to the 7th report of the Joint National Committee on Prevention, Detection, Evaluation, and Treatment of High Blood Pressure, Nadine's ideal blood pressure should be 130/80.
Oh, Henry, thank goodness you acted so quickly and got me to Galen Hospital. You saved my life. That stroke surely would have killed me.
Oh, I love you, Nadine. Let's make bacon. Oh, baby. Oh, never mind. False alarm. Good night.
Goodbye!
Bam!